Hello, my name is Koert De Waal. I'm a neonatologist from John Hunter Hospital in Newcastle, Australia. I was born and trained mostly in the Netherlands and partly in Australia, and my passion is neonatal hemodynamics. I'm really proud to be here at the 9th at the 9th Arab Neonatal Care Conference, where I was invited to come do two things. One was a workshop, which was about neonatal hemodynamics. We're here with local faculty. We discussed with a group of about 20 participants to learn the skills of neonatal ultrasound and how that can help in everyday clinical practice. Then we talked today about two interesting topics, which was diastolic heart function and heart-lung interactions, which is not commonly discussed in any everyday neonatal care, but brings us closer to the actual reality of neonatal hemodynamics and what ultrasound can do to help you think about neonatal cases. I think most of the day for me was about teaching the concepts of neonatal hemodynamics from a basic point of physiology and try to connect it to your actual everyday clinical cases. So I hope from my lectures and the other lectures of today that the people have enjoyed being part of the workshop and of the lectures and have picked up some of the main messages about how neonatal hemodynamics and ultrasound can help you in everyday clinical practice.
Bismillah ar-Rahman ar-Rahim. I'm Dr. Abeer Miqdad from Security Forces Hospital Riyadh. This is my first time to be here in Dubai to attend this conference, which is the 9th International Neonatal Conference, and it was my pleasure to be here. It is behind my perspective from this conference. The scientific committee, they were very organized. I get a lot of information from this conference. Even I am a consultant, even they refresh my basic, and also they are very updated. I met with a lot of consultants coming from outside and also the local consultant. We share a lot of experience and it was very informative. If I'll be here to the next year, I will attend again and I will ask all of my colleagues to come and attend this conference, which is very informative one and very also the helpful, the scientific committee who are with us. Thank you very much.
Assalamu alaikum. My name is Yahya Ethawi. I am in-house neonatologist. Work with Winnipeg Regional Health Authority in province of Manitoba, Canada, and also I do pediatric transport with Manitoba Pediatric Transport Program in Canada. In addition to that, I do general pediatric with St. Boniface General Hospital. I am here to attend the 9th International Conference after a kind invitation from the organizer of the Arab Neonatal Care Group. And I'm here attending this amazing conference. Lots of international scholars. Actually, I feel like unbelievable what I saw from the gathering, from the scientific programs, from the discussion. So from my side, I gave a talk about my PhD, which is use of contactless imaging, a new modality, a new way to see pediatrics, children and newborns. It was like 25 and we have lots of amazing feedback from the audience. In addition to that, I do 3 workshops. My workshops concentrate on one thing, that physicians, pediatricians and neonatologists, those who care very sick, should start to use ultrasound to assess and help them to make correct diagnosis and then the management. And the ultrasound that we're talking is not radiology ultrasound, not the ultrasound by radiologists, but by the frontier, by physicians who look after sick babies. So today I did an ultrasound to assess sick bowels, and I thought that the feedback was very good. The audience liked it and they want me to repeat it, and probably many of them need to practice it, so we need to enforce that. Tomorrow we will do another ultrasound in another area, which is the brain. So we hope that from today positive feedback will encourage others to attend. And at the end of the conference, we'll do another workshop about use of head ultrasound to diagnose and assess respiratory problem in neonate and in pediatric. And we're hoping to replace X-ray because X-ray are expensive and there is a lots of radiology disaster on the baby. So I wish the conference all the success. I'm very happy to be here, and I hope that I will come again if I'm invited. And I think what you guys are doing here are amazing, and you're forcing to develop and start research in a scholar way of thinking in caring children and neonate in Emirate and in all Arab countries and Middle East. So I wish the conference all the success, and I hope I see you all next year.
Hi, my name is Sarah Neilson. I'm a clinical specialist occupational therapist. I'm working at the Evelina London Children's Hospital. I was invited here to speak by my consultant Tomoki Arichi as part of his workshop, and I was asked to present on high-risk infants in the neonatal unit and thinking about the risk and prevalence of some of the developmental difficulties that they experience and what early assessments we should use to be able to assess their neurological deficits and how we should address these. I think it was a really useful conference and workshop, and it brought together various different therapists and doctors from different hospitals and from different countries to compare practice and try and align our practice in terms of the evidence base that's out there at the moment. And I think all the talks were really useful, and the opportunity to have the discussion and the interaction with the panel was really useful. And yes, I was very grateful and lucky to be here.
My name is Dr. Porus Bustani. I'm a consultant neonatologist from Sheffield Teaching Hospitals in the UK. I've been privileged to be invited here for the Dubai Arab Neonatal Conference for 2018 by Dr. Khaled El-Atawi. I've been asked to come and speak for a couple of lectures about my interest in respiratory medicine and neonatology, and I've also participated in a workshop on the first day looking at the management of early newborn respiratory care. And I found the experience of teaching over here very valuable for myself, and there's been a number of opportunities that I've enjoyed while I've been over here. The ability to go and teach what I think is an important part of neonatal care has been good. I've had feedback in each of my sessions that actually makes me think again about how it is I deliver this same care that I've spoken about as well. I've had the opportunity to meet people from a whole breadth of different specialities within neonates, from a whole range of hospitals and cultures. And actually the meeting people from different cultures has been one of the most invaluable things that I found over here. Some really nice people in a fabulous environment, in a wonderful city, and in an excellent conference. And I wasn't sure what to expect when I came here, but whatever it is, I've exceeded those expectations having come over here. And I'd love to be able to come over again and to go and help teach and to learn, because it's also been a learning experience for me as well. So thank you for the opportunity, and hope to see you at future conferences here as well.
أنا هايدي الوسية, Assistant Professor at King Abdulaziz University, Jeddah, Saudi Arabia. It was a pleasure and honor to be invited to be one of the speakers today in the 9th International.Arab Conference for the Neonatal Care. I was very happy to be invited to speak about a topic that I really adore and love to talk about, and I was very happy to see it one of the very important topics in the agenda of the conference this time. I was invited to speak about neonatal pain and the advances in neonatal pain assessment and management and the standard of care in the NICU to take care of the very small ones, neonatal pain. The conference was actually very updated in terms of it included wide variety of topics and subjects presented by speakers from the Gulf area and international speakers. Included many different topics, and the nice thing about all the topics that were presented today, it all were updates rather than review of the topics of the neonatal care.
Hello, my name is Dr. Tomoki Arichi. I am a consultant in paediatric neurodisability at the Evelina London Children's Hospital in the UK. I'm also a senior researcher for King's College, researching how the human brain develops during early life, particularly using MRI methods, and trying to understand how this development is altered by effects such as preterm birth or brain injury. At the conference, I'll be speaking about how we can use MR methods to understand how the brain is developing in a very quantitative and statistical way, and also to understand new methods like connectomics. I'll also be leading a workshop and presenting in a workshop so that we can consider and discuss about how neurodevelopment is affected by premature birth. This is particularly important because we know premature birth is becoming increasingly common, and that the children, although we have become better at helping these children survive, the children are often very severely affected in terms of their learning, their behaviour, and also with their motor outcome with conditions such as cerebral palsy in the long term. And so in the workshop we will be discussing about what the risk factors are for these kind of problems and how we can try and identify them at an early stage.
My name is Rania El-Farrash. I'm a professor of pediatrics and neonatology in Shams University, fellow of American Association of Respiratory Care and Egypt representative at the International Council for Respiratory Care. Also, I'm IBCLC, International Board Certified Lactation Consultant. I'm here presenting two PowerPoint presentation and carrying out two workshops. First workshop about advanced mechanical ventilation, and the second workshop about post-delivery stabilization. My talks were about first myth versus fact about breastfeeding, also neurodevelopmental prediction in a case with skin lesion, neonatal skin lesion, and the last one was about meconium aspiration syndrome. Actually, the whole environment is encouraging, and meeting young, ambitious neonatologists is giving us hope. Different cultures, different nationalities, and many speakers from all over the world. This year, carrying the advantage of meeting so many people and doctors, pioneers in their experience. Thank you.
My name is Dr. Alok Sharma. I'm a consultant neonatologist from University Hospitals of Southampton, UK. And I've been invited to talk at the Arab Neonatal Conference in Dubai on behalf of the Improve Academy. This has been a great honor. And I think from my perspective, the academic feast that has been on display at the conference has been absolutely amazing. I think in addition to being able to deliver a good deal in terms of what I'm doing, I'm actually getting, and I have had a huge amount of exposure and the ability to actually meet professionals from all over the world who've actually spread my knowledge in neonatal cardiology and neonatal neurology. I'm here on behalf of the Improve Academy. We're running two workshops, one on neonatal ventilation and the other on neonatal simulation, where we're specifically looking at neonatal stabilization of the preterm baby. I think the amount of work that's being done in the Middle East at this particular point is absolutely amazing. And actually the things that I'm taking home from the workshops, which I came here to teach, but actually I have learned from people over here. I think one of the important things is we're all interested and we all want to make and bring the best outcomes for the babies we look after. And I think this has been a great opportunity for us to link up with great minds from the Middle East, from Egypt, from Iraq, from UAE, from Saudi Arabia, so that what we can actually do is learn together in this environment in order to reproduce the best outcomes for our babies. I would like to thank Dr. Khaled El-Atawi, Dr. Adel, and Dr. Mohamed Mustafa, all my brethren, for inviting me and giving me this opportunity to share the stage with them. Thank you so much.
I'm Dr. Lamia Baznz from Syria, Head Department of Pediatric in Damascus Hospital. First of all, I want to thank Dr. Khaled El-Atawi and all organizers in this conference to share this perfect conference. Indeed, it was perfectly organized conference, and on the other hand, it was a very successful lecture and information up to date. It was very useful for us, and all lectures, it was up to date. I hope we are going to meet again in the nearest future with more information up to date and advanced. Thank you for all again.
I am Professor Khaled El-Falah from Saudi Arabia. I work at King Saud University I have been invited to this prestigious scientific meeting to talk about formula market in the GCC countries. It has been a great pleasure to participate in the meeting. I had my talk yesterday. We had a great interaction with the talk and an excellent questions and discussion around the talk. I've enjoyed my stay and I enjoyed the titles of the presentations of all the speakers. All the presentations have addressed the latest issue in the neonatal field with the latest evidence-based practice. It will be my pleasure to attend and participate in this meeting in future events.
Good evening. I'm Professor Noaman Nafea from College of Medicine, Baghdad University. I'm also a consultant pediatrician in Children Welfare Teaching Hospital, Medical City Complex, Baghdad in Iraq. I'm attending the 9th Annual Arab Neonatal Care Conference for the first time, and I have been invited by the committee to be a chairperson and to participate in as a speaker and presentation on neonatal jaundice. And I found that this conference is very useful, and I hope that it will be made in the next year and inviting more people from different countries and also from junior doctors and residents, and to help them to present studies about neonatal care in their countries, which might help also to improve their knowledge, attitude and skills and being a leader in the future. So I would like to thank the responsible persons here, the scientific committee, and to invite me.
My name is Zakariya Al-Salam. I'm a consultant neonatologist. It's my pleasure to be present at this conference. First of all, I would like to thank the organizing committee, and a special thanks to Dr. Khaled El-Atawi. I have been a regular visitor to this conference in the form of a speaker or workshop trainer, and every year I see an advancement in the conference, and I see that tendency getting more and more. It is very well supported, and it has a very good reputation all over the country, and I see people coming from the other Arab countries. I think every year I come here, I come for two reasons. One of them is to learn, although I'm a speaker, and the second reason is to make a new connection and network with other healthcare givers, especially in the field of neonatology. So this year I learned a lot from different speakers from all over the world, and again, it's an honor to be here.
Hi, my name is Dr. Ahmed Adel. This is the 9th time I'm participating in the Arab Neonatal Care Conference as organizer, one of the organizing committee. And this year I'm also participating as a speaker in the simulation-based functional echo training workshop, where we used mannequins to train neonatologists on the views, basic views, and how to handle the echo machine and the echo probes. And the outcome was really good. The neonatologists were happy, and they felt that they gained a milestone. Of course, it needed more training, but it was a very successful outcome of the workshop. Every year, the organizing board and scientific board held meetings, and they try to invite the experts of neonatology in the world. They try to communicate with the neonatology leaders to bring their new and advanced techniques in neonatal ventilation, neurodevelopment, cardiology, and all the other subspecialties. And this year is as usual, and always the feedback of the participants that that we exceed their expectations, and they get a lot of knowledge that they can take home. We have participants from all over the region, and even from Europe and Africa, and we are glad that the participants are happy with the preparation and the scientific content, and we wish to see you next year in our conference. Thank you.
Good afternoon. My name is Zuzana Tomaskova and I'm from Czech Republic. I worked 8 years in Saudi Arabia, so this is my third conference here in Dubai. This year I spoke about neonatal ventilation care for the nursing part and the coordination together with doctors. Then my next topics are about developmental care together with a workshop, which is quite important these days in all neonatal care units. I think it's very important for the neonatal nurses to attend the conferences such like that, because they can gain more information, they can learn different things from our doctors, and as well they can share their experience with the doctors and with the whole nursing, the neonatal nursing public.